Hey everyone, I'm Whitney Morgan, Hashimoto's coach, gluten-free warrior, and creator of the thyroid reboot method and the gluten gauntlet system. In today's video, I'm going to teach you how to get the best thyroid test possible, because I guarantee you there's one thyroid marker that you absolutely need to be checking that your doctor isn't ordering. But before we jump into it, I want you to go ahead and hit that subscribe button and the little bell next to it so you'll get notified every time I drop a new video. If you have Hashimoto's or hypothyroidism, you're going to want to tune in on a regular basis. Now, I've worked with dozens of women who continue to struggle with hypothyroid or Hashimoto's symptoms, even though they're taking medication for their thyroid. And making sure they get the most comprehensive testing to assess their thyroid function is part of step 1 of my thyroid reboot method. Most of the time, when your doctor orders what they call a complete thyroid panel, it's not as comprehensive as it should be. Now, quite frequently, they're not even checking on your antibodies, but most definitely, 99% of the time, they are not ordering one critical marker, and that's reverse T3. Now, when it comes to your thyroid function, reverse T3 is like kryptonite. Without getting too nerdy on you, there are two main thyroid hormones, T4 and T3. Most of the hormone that your thyroid gland produces is T4, and that's the more inactive form of thyroid hormone. It doesn't drive metabolism. It has to be converted into T3 in order to get into the cells where your body needs it. Ultimately, it's your T3 levels that drive your metabolic function and determine how you feel on a day-to-day basis. But here's the deal. When you're under stress, your body actually takes that T4 and converts it into reverse T3 instead of T3. And like I said, reverse T3 is kryptonite. You can think about it this way. If your body is a sports car, T3 would be the gas pedal. It's what gets you down the road. Reverse T3, however, is the brake pedal. The problem is that both T3 and reverse T3 are competing for the same cell receptor docking sites on every cell in your body. So when you have a lot of reverse T3 floating around in your bloodstream because you're under a lot of stress, it starts taking up a heck of a lot more space on those cell receptors. And basically, it ends up slamming on the brakes in your sports car. The tricky thing is that the symptoms of too much reverse T3 are the same as symptoms of low T3, right? Of your basic hypothyroid or Hashimoto's symptoms. So you're going to experience things like dry skin and weight gain, constipation, fatigue, anxiety, irritability, mood swings, depression. You might have poor memory or PMS, joint and muscle pain. I mean, you know the drill, right? Now, you might be saying to yourself, well, Whitney, I don't think reverse T3 is my problem because I'm not particularly stressed out. Now, some reasons why your reverse T3 levels might keep going up are things like, of course, mental, emotional stress or, a busy life, go, 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 that kind of thing, burning the candle at both ends. But then there are some other things like certain medications will drive up reverse T3. Sometimes things like intermittent fasting or prolonged fasting or insufficient carbohydrate intake or calorie restriction, those things will pump up your reverse T3. So will heavy metal toxicity and chronic infections like underlying chronic viruses or a parasite in your gut or bacterial overgrowth or yeast, things like that. And then of course there are things like nutrient deficiencies, leaky gut, unidentified food sensitivities. All of these things are sources of stress that your body recognizes and then encourages the conversion of T4 into reverse T3. Have you ever had the experience of continuing to struggle with hypothyroid symptoms, even though your doctor says that your test results are normal and your T3 levels are fine? If so, drop me an eye roll emoji in the comments, okay? Now, if you've been lucky enough to get your doctor to include reverse T3 on one of your thyroid labs, awesome. But how do you know if there's too much reverse T3? How much is too much? Now, in the land of traditional medicine, the standard reference range for reverse T3 is somewhere between 9 and 25. But in the functional world, we like to see reverse T3 levels below 15. But even if your reverse T3 levels look good, your body still might be riding the brakes. And that's because if the ratio between your free T3 and your reverse T3 falls too low, you can wind up with many of those hypothyroid symptoms I just described. So the moral of this story is, if your doctor is telling you that your thyroid labs look normal, but you still are struggling with some of those symptoms, reverse T3 might be the culprit. And of course, the only way to accurately assess whether or not reverse T3 is a variable in how you feel is to test for it. You have to test for the individual levels, and you have to be able to calculate the ratio. Unfortunately, many of my clients have experienced that when they ask their doctor to run reverse T3, their doctor just flat out refuses. My clients have been told by their doctors the reverse T3 doesn't matter, it's not relevant, and instead their doctors have just upped their levothyroxine dose or their synthroid dose and said, let's just increase your medication and see if you feel better. But here's the problem with that. When your reverse T3 levels or the ratio between free T3 and reverse T3 are out of whack, adjusting medication is rarely helpful. And that's because the majority of thyroid medication prescribed in this country are T4 only medications. And when your body is converting the majority of your T4 into reverse T3, well, upping your dose of T4 gets you nowhere. If you want to learn more about how to make sense of the thyroid labs that your doctor's running on you and how to make sure that you're getting the most comprehensive lab testing that's available, download my free thyroid lab test interpretation guide. Just use the link in the video description notes. If you're watching me on Instagram, just head to my bio link and you'll find the download there. Thanks for watching, everybody. And if you found this video helpful, you can let me know by liking it, subscribing to my channel, and maybe share this with a friend who has Hashimoto's or hypothyroidism. And if you have questions, just leave them for me in the comments. I do my best to reply to each and every one. All right, I'll see you next week.